So a couple things. 1 Corinthians 14:40. But all things must be done properly and in an orderly manner. And I know that this is out of context. This is having to do with the church and how church services are supposed to run, but this really is applicable when it comes to dealing with medical emergencies. It does not work well if everyone's losing their heads. You shut that. Sorry. Thank you. It does not work well if everyone's losing their heads when an emergency happens. And then also, as we think about this, 1 Corinthians 10:31, whether we eat or drink or whatsoever we do all to the glory of God. And how we respond to things can glorify God. And as we look at this, so we're going to be looking at this, a little bit of history about me. No, we're going to do that instead. So, I found that off the internet just like this week. So I found a picture of myself on the internet. I was a little younger then. A lot younger, actually. So I worked in EMS for about 10 and a half years. I worked as a paramedic for about 7 and a half of those. I worked for ambulance service in I did work in North Conroe, New Hampshire for a couple years. But the majority of my time was through North Star EMS over in Franklin County. It is actually one of the largest coverage areas in the state of Maine for an ambulance service. Actually, I think it is the largest. It's actually a subsidiary of Maine Health. This is not about me. They are known for getting very good quality care and very good documentation. They have a very high standard as far as it comes to making sure that they, almost every single one of the run reports that I would write would have someone else look at it, and I would probably end up getting at least 1 or 2 questions a week about, so why did you do it this way as opposed to that way? And one of the things that we can look in our Christian lives even, is that when we're willing to be asked questions and answer questions about different things, and it was a good humbling experience. Did not always take it well, but it was good for me. I was trained as a first aid and CPR instructor by the AHA for a couple of years. I did not teach any classes. I taught 1 class, and then I was busy. I was in paramedic school at the time. But I did get trained in that, and I was also certified as a wilderness EMT. So there was a few different additional protocols that were involved with that. So as we're looking at this, a few things to consider when we're looking at medical emergencies. Having a base knowledge of things is important. So I would encourage everyone, if you took I can tell you this, CPR changed drastically from the time I was 16 to the time I was 20. I have not taken a CPR class in close to 10 years, and I'm guessing it has changed some, although it has stabilized some. As I try to kind of take a look, every once in a while I try to stay up on what the current suggestions are. But CPR and first aid are skills. And the thing with skills is if you don't use them, you lose them. And having a good reminder of those, I would recommend everyone try to take a CPR class, first aid class. I understand that that's not always the case. On the back of your sheets, there are those references to the American Red Cross and the American Heart Association, and you can find a class near you, or as close to you as you can, that's registered through them. But you can also check your local hospital, check your local fire department. They might have resources for you. Again, when we're talking about medical emergencies, we are not trying to develop a confidence in ourselves, but in the Lord. However, knowledge, familiarity, and practice will develop confidence and certainty during emergency times. The last thing you want is when you are experiencing an emergency, you're trying to figure out what to do at that point. The last thing you want is when someone's bleeding profusely is to be looking through the first aid kit's instruction manual about how to deal with it in that moment. So having those sort of things already in place, already in mind, helps. And it's a mindset. It's thinking about things in those ways. Because this is basically a truth. They do this with soldiers, they do this with medical providers, they do this with all sorts of other things. The higher your adrenaline increases, your critical thinking goes down. So yeah, basically, the more that you can have it become just a mindset, you're thinking about it, you've done some practice, the better it's going to be, and the easier it's going to be. So have a plan in place ahead of time. So do you have people already trained in first aid and CPR? Who are those resources? And this would be something to talk with, if you're not a leader in the church, this is things to talk with your pastor. And so for instance, here at First Baptist, we actually have an emergency response committee. This is to deal with what if someone who shows up and they're violent? What do we do if, basically a security team, but it's more than that. What happens if someone falls down the stairs and cracks their head open? How do we deal with that? We have people in place. We have a designated caller, and we have a backup. And we really should have not only a primary, secondary, but also a tertiary, or a third person that you could have who can call. Do you know your address? I can tell you I don't always remember what our physical address is. It's next to Zeb's. Do you know what to do with any non-incident related people? So, I mean, God forbid, what is the plan if someone all of a sudden has an altered mental status, whether they're having a stroke or they collapse from a heart attack in the auditorium during the morning service? How do you handle that? What do you do? I will tell you what I would do. If I'm up front, Lord willing, I'll actually see it. Probably everyone else will hear it. And then basically, I know certain individuals that I'm going to select to do CPR, unless one of them is the person that we have to do it on, and have everyone else get out of the room. You're trying to create space, and maybe you can't all get out of the room at once. It's not everyone run for the doors, but it's an orderly, neat. You assign someone. I need you to carefully and slowly make sure everyone gets out of the room. You're going to go downstairs and you're going to pray. And that gives people something to do. It gets them out of the way and allows those who are needing to do something to care for the person. It allows them to do the task that they need to. Might go into a little bit more, but I can teach anyone basic CPR in about 15 seconds. It really isn't that hard. It's very, very easy. And for first on scene, it's very uncomplicated. Do you have any resources in the community? Questions to ask. How far away is the fire department? How far away is the police department? Because often police officers are one of your first responders. A lot of them actually, most of them are trained in CPR and first aid, and a lot of them actually have at least around here, I'm not sure, but in Franklin County, a lot of them had an AED in the back of their cruiser. So just things to think about. I actually happen to know that Horse Feathers next to Zeb's, at least, is working on having another AED. So I know that if I need one, I can send someone to go next door to go to Horse Feathers, tell the receptionist, we have a cardiac event, we need the AED. And they should allow that to happen. So just those sort of things. And I think Zeb's might even be working on getting one too, I'm not sure. Do you know your physical address? Just things to keep in mind as you're thinking about medical emergencies. And these are things, if there are concerns, and this is something to consider, your pastor may not, for me, I lived and breathed this stuff for 10 years. Not every pastor does. And something that may be important to you is not necessarily something that they've thought of. And so this is something where you can come to your church leader and say, hey, this is something that I've been thinking about, considering. I would like to get more information. Or you can say, here's some information that I've gathered. What can we do? And actually, something else that you can do is consider, there may even be someone who is willing to come and do a CPR first aid class for your church at your church. It depends. So things to think about. So when it comes to medical emergencies, there are going to be basically two types. You have your medical and your trauma. So medical would be like cardiac or heart related. This may or may not be a cardiac arrest where someone collapses and you're doing CPR, but maybe it's chest pain. Respiratory, diabetic, stroke, or you can be really fancy, CVA or TIA, that is cerebral vascular accident or transischemic attack. So just those are the fancy words. And then, or temperature related, are they too hot, are they too cold? They can also, like seizures, and there's different types of seizures. So for instance, one of our young girls here, she will occasionally have seizures, but you would not know it necessarily to look at her. So just things to keep in mind, not all seizures are the same. And then you have traumatic, so fractures, burns, lacerations or cuts, punctures, falls, what sort of things to keep in mind. When you are thinking church related, I'm sorry, so for the older, more mature people here, you already know this, transitions start becoming more of a problem. Stairs, changes from carpet to non-carpet, wrinkles in the carpet, the nice water hog mats in front of the door, those are things that can cause problems. Uneven floors, things to keep in mind, things to be aware of. How accessible is the bathroom? By the way, so these are things that I've been rattling through as you start thinking about it. Is there a way into the bathroom if someone goes unconscious in the bathroom? I know that sounds really, we're Christians here, we're very prim and proper, but unfortunately, a lot of the heart-related stuff or fall-related stuff that I responded to, guess where it was? In the bathroom. So do you have access to a bathroom? I know the bathroom upstairs has a deadbolt. Guess what? That door's getting broken. There's no other way to get in. You're going to get it kicked down. Does the door open in or out? Those sort of things. Just things to think about. And of course, you're going to be done in this class, you're going to go to your pastor, you're going to have all these things, I have all these concerns, and you want them done like right now, and guess what? It takes some time trying to figure things out. So just as we're talking, it's like, yeah, okay, we need to deal with that. Like those sort of things. So just things to keep in mind. So typically, when it comes to a medical emergency, say someone is having some sort of cardiac event, it's not cardiac arrest, but they're all of a sudden you're looking at them and they went from talking to you, they've been calm, they are coherent, and all of a sudden they start acting incorrectly. You're noticing something's wrong, and they start, guess what? Our bodies tell us a lot, and we start acting wrong. You may not be able to do a whole lot. However, there are some things you can do. A good past medical history, or PMX, PMH with an X, a past medical history is important. What's the age? Date of birth? When did this start happening? Paying attention to those things. All right, I'm going to do a test. Good afternoon. Good afternoon. Does anyone know what day it is?
Friday.
Okay, you just passed. So very, very quickly, I just did an assessment on how you all are doing. how are you cognating? If I'm watching someone and they start acting lethargic or not right, their skin starts getting a little pale or clammy, their color looks wrong, they're starting to change color. That tells us things, right? Just by observing. You're just learning to watch and see what's going on. That's why sometimes these are a problem, because these have taught us not to be super observant. We're doing this kind of thing. So you can get a good past medical history and maybe a basic assessment. If you can find a pulse, sometimes you can't, depending on what's going on, you find a pulse. Is it regular or irregular? That'll tell you a lot. Maybe it's normally irregular for someone. Is it fast or is it slow? Just some basic things. Practice on yourself. Practice on your spouse or on your brother or sister or parents or kids or whatever, but it's a good practice. Guess what? It's going to be easier to find a pulse on me than probably my son, Titus. Kids are a little harder to find stuff on sometimes. All right, so just some basic things. And so what we're going to spend a little bit of our time now, we're only 15 minutes in, we got a little bit of time, we're doing well. But what I'm going to do is I'm going to teach you an acronym called SAMPLE. It's a sample of history, and this is going to help you. So these are things that you can help. These are not things that you necessarily have to have all ready for when you call 911. However, there's certain things that are helpful. Age and name of the patient, not always the name, but age, what is the primary symptom, and then when did this happen, like those sort of things. And so just things to consider. So SAMPLE is an acronym. It is used by medical professionals and other first responders, and it will give you a little bit of things. And so it's one of those things, as you are thinking through this, you're going to think it in this order, but then what happens is you actually find, as you think through it and you go over it, it's something that you kind of start acquiring automatically. So first is S, signs and symptoms. So signs are things that you observe. Mental status, are they acting normal for them, right? So you may have someone who's already limited in their ability or capacity to communicate or ambulate. Are they acting normal for them? And that's going to be one of the things that a medical provider, if you call the ambulance, and the other thing too is have one person giving the report. So the last thing an EMT wants is walking in to take care of something and you have like 5 people talking. Pick one person, they're going to do the talking, and then go from there. And then, so ABCs, airway, breathing, circulation. If those aren't right, you got a problem. So are they choking or are they not? Can they talk? Can they move air? That's actually something to, so this is a misnomer. If someone's choking and they're able to move air, don't slap them on the back. That's actually, that often makes them go, and then that lodges even better. So slapping on the back is out when they're coughing or choking. Are they moving air? Are they breathing? What's the quality of their breathing? You know what this is like, right? You exercise or you go up some stairs or you're carrying something heavy. What happens to your breathing? Right? If someone's doing that and they're sitting there and they haven't done anything, probably something's wrong. Or possibly. Circulation. Circulation shows up with their skin color. What does their pulse feel like? Are they pale and diaphoretic? In other words, are they sweaty? All right, so things to think about. So few just really quick assessment tools. Look at your fingernail. See how it's nice and red? Squeeze one of your fingernails. Let off and watch and see how quickly you turned it white, you blanched it, and then you let off. How fast does it turn back? A few seconds, right? Mm-hmm. If someone's not doing well, And what's actually happening is your peripheral vasculature is starting to shut down, so get blood to the important vitals. That's going to slow down. How about people who are a little darker skinned? Like, how do you tell if they're pale? How do you know if they're not getting the oxygen they need? Well, you can do capillary refill, or you get personal in this. You pull down and you look and see how pink that is right under their eye, because that's just information. So signs, what do I see? Symptoms, what are they telling me? So I have chest pain. I'm having trouble breathing. I don't feel right. Something like that.
Excuse me, Nathan.
Yes.
Just say something about that symptoms is, I think one of the things we have to be careful about is you can ask a person, how are you doing, how are you feeling, and they're going to say, I'm okay. Don't just take that.
No, don't take that for granted.
Look at the other signs.
So, and that's why it's important. You're watching them, and they're like sweating, they're pale, and are you okay? No, I'm fine. And at that point, don't leave them alone.
Right.
Say, okay, and then so you stay with them, or if someone knows what they're doing, you stay with them, and you maybe get help. And yeah.
Another thing is to watch their facial expressions.
Yes.
Even if they say, no, I'm fine, but their eyes are darting.
Yeah, so like some of it comes down to just basic paying attention, and it's something that comes with just doing it, where you're just paying attention. Are they anxious? Are they restless? Are they not able to sit still? Are they constantly shifting? Are they like afraid they're gonna die? Like those sort of things. And then so signs and symptoms, those are really important to try to get in place, because then if the emergency crew comes, you say they're complaining of chest pain, started about 10 minutes ago, they're having trouble breathing, they're feeling lightheaded, and their pulse is really rapid and thready feeling, I can barely feel it. That gives them a lot of information really quick, and that's something that you can get ahead of time. So A for your sample is allergies. Is there anything that the patient is allergic to that could result in a life-threatening situation or severely inhibit them? As you get older, you start carrying around a medication card list. Really good idea. If you're on medications, you should probably have a list. Have a list on you. And in addition, any allergies. Sometimes you see the medical bracelets. I actually had a patient once who had they had a lot of them, had their allergies tattooed on their arm.
Oh my God.
I was like, well, that's great, but if I didn't know to look there, but anyways, they had enough of them. I was like, well, okay. I'm like, so do you have any allergies? And they went, I'm like, oh, okay. So if they do have an allergy, do they have anything with them to treat it? Do they have Benadryl? Do they have an EpiPen? One of those things. As far as when to give the EpiPen, I got somebody being allergic to them. Well, are they exhibiting signs and symptoms of anaphylaxis, or do you wait a little bit and then give it to them? Because if you give it to them too soon, then you just used it in case it starts getting worse again. So just things to consider. But do they have any allergies? This is not, well, I'm allergic to cat dander, I get seasonal allergies, I get the sniffles. Like, that's not really what you're trying to figure out. Are there medications, or are there any food allergies? Like something that is going to cause harm to this patient and possibly threaten their life in the next 5 to 30 minutes. Like just those sort of things. So signs and symptoms, allergies, medications. Do they have their list of medications with them? That sort of thing. This could include vitamins, but I said, well, I take my daily vitamin and I have my vitamin C. If you just say all I take for medications are daily vitamins, that's all they really need to hear. Like, oh, okay. So, because I can tell you, and I'm a little bit behind on the newer medications, but if I looked at your med list, I could probably tell you some of the things that you're being treated for just by looking at the medications. So that's why having those, so have a sheet of paper, you write down a few things, age, date of birth, allergies, medications, and you can hand that to an emergency provider. And you may not have time to do all of this, but if you can just even start, it at least gives them something to work with. You're trying to help out. And when they show up, get out of the way. It's one of those things. Past medical history. So again, this goes back to, do they have cardiac or heart problems? Now, I have had patients, I don't know how many times. So do you have heart problems? No. Well, why are you taking this metoprolol? Well, that's to take care of my blood pressure and because of my heart attack. I thought you said, well, they fixed it. No, they kind of fixed it, but that's really important information to know. There's been times as a paramedic I've tried to get a past medical history, and then I walk into the emergency room and the patient goes, yeah, I had open heart surgery 2 years ago. And then I look like an idiot because I didn't know that, and I had asked them directly. Now, so just things to think about. So have they had a heart attack before? Do they have blood pressure related things? Have they had clots? Do they have CHF, which is congestive heart failure? So your heart's just not affecting. Another one is AFib. Guess what? If you're over the age of 75, like 90% of people will develop AFib at some point during their lives. That's just the way it is. Do they have any respiratory problems? Do they have asthma, emphysema, typically a smoker's thing or former smoker's thing, or COPD, or chronic obstructive pulmonary disease is what COPD is. What sort of things do they have? Are they diabetic? Guess what? Diabetics aren't fair. They cheat. When they present with something, they may not present like a normal person. So guess what? Diabetic could have a full-blown heart attack without cardiac arrest, and they not know it because their senses are going to be different. They may not present in the same way, and that's really helpful information for emergency crews to know if they're a diabetic. Also, altered mental status, that could be it. That could be one of the causes. Do they have any surgical history? And this is not like, I have surgical history. I had tubes put in when I was an infant. They don't need to know that right now. I also had oral surgery. They don't need to know that either right now. But like, did they have a bypass or a stent? Those sort of things. Recent falls or other injuries. Did they fall in the last month or so? What happened? Those sort of things. So, signs and symptoms, allergies, medications, past medical history, last oral intake. When did the patient eat or drink last, and what was it? They don't need a detailed list, but when did they eat? So, especially if they're diabetic, and they took their insulin and then didn't eat for an hour. I had a patient that did that once. My blood sugar's been low every morning, and then I'm sitting there watching the patient take their insulin, and then they aren't eating for like over an hour, and they wonder why their insulin drops every morning, or their blood sugar drops. That's why. So when did they eat last? Did they have something that they are now having a reaction to? Have they not had anything to eat or drink? So it's been hot. I mean, it's warm in here already. We might need to open a window soon, but it's hot. Haven't had water. We've been sweating, and now I'm feeling lightheaded. Well, maybe we need some water. Maybe we need to sit down. Did they take a medication that they are now experiencing the effects of? One of those things, people, as you get older, I have chest pain, like intermittent chest pain. I pop a nitro, and it helps the chest pain go away. And guess what? Nitro can make you feel a little lightheaded sometimes. So, and then the other thing too, and I don't have it up here, and that's probably on the past medical history, is have they had any recent medication changes? So if someone's taking a new medication and they're still trying to figure out, I don't know how it's affecting me, or they're still trying to figure out the exact dose. These are things to consider.
Nathan,
Yes.
that medication history, things can change even though you've been on a medication for some time. In our church in Harrington,
Yes.
just had a good brother pass away. He took lisinopril that he's been on for a long time, and all of a sudden, his tongue swelled up.
Yep.
So he had anaphylaxis from it. The time they
Yep.
got him to Ellsworth, the hospital, they couldn't even intubate him. They had a treatment,
So
and then he passed.
that's too bad. And that's an example of those sort of things. One of the other things along those lines, say someone's allergic, and this is why you hold off on the epi until you know for sure if they're having a reaction. And someone can have an allergic reaction to a bee sting one time and not the next.
Or vice versa.
Or vice versa. So I've been stung lots of times and I've never had a reaction, and all of a sudden I do. So some things to think about. Epinephrine's great. Liquid Benadryl is kind of like the long-term effect. So and liquid Benadryl acts faster than tablet form. So just things to think about, what to have with you, what to keep around. And then finally, events leading up to. What are the concise events that cause the current symptoms in the patient? They do not need to have lots and lots of backstory and all of that. So here's a not concise. We had a girl who was playing tag, and I didn't really see what happened. Well, here I could say what happened. She's allergic to cats and takes anti-seizure medications. But anyway, she fell and got hurt really bad. She's bleeding everywhere. So much blood, so much blood. It's really bad. Oh, the bleeding is not good. She's not acting right. That doesn't help, right? It's just very, very discombobulated. It's disorderly. Or you could say, let's see if I have this here. Or we have a 6-year-old female. She was playing tags with her friends. She tripped, fell, struck her head. She is now currently bleeding. She is acting lethargic and not responding to vocal commands. That's really all you need. She does have a history of seizures, but has not had any in the last 2 months. That gives a lot of the information that they need. By the way, head injuries are going to bleed a lot. We have a lot of vasculature on our scalps. If you get a cut on your forehead, it's going to bleed. It's going to look awful. It probably isn't. It could be, but bleeding from the scalp is also often not going to be the major problem. What would be the major problem of the patient that I just told you about? Is it the bleeding or the lethargic? It's the lethargic. It's the lethargic with a history of seizures that might be a problem, right? So just things to keep in mind. There's a time and a place for a more detailed description. Typically, if EMS is showing up, they're going to want to know how long ago did this happen, what directly contributed to the patient's current condition, and what has been done as a result, and did the patient get better or worse. So they fell, they were unconscious, but they are starting, and they were incoherent. They weren't incoherent when they first came to, but they are regaining consciousness and they're starting to make more sense now. That's important information. Just those sort of things to keep up. So here we go. We have a 4-year-old girl who's running, tripped, fell, struck her head. She is cut on her forehead and is currently not acting herself. She is lethargic and she is not responding to simple commands as normal. She is not crying. That's a big problem for a 4-year-old girl. She's not crying. This happened 10 minutes ago. That gives a lot of information. She has no medical conditions and does not, or in this case, no medical conditions and does not take any medications, and her last oral intake was approximately an hour ago. Just those sort of things. So, a couple of life-saving skills. Most bleeding is controlled with well-aimed direct pressure. If not capable of controlling with direct pressure, a tourniquet is applied to a long bone, either the femur or the humerus. You have a lot of blood vessels in your forearm, but they go between your radius and ulna. So if you try to put a tourniquet here, it's not going to stop it. It's, your bones are going to actually act like a splint to not be able to compress it. So you want here or around the thigh, at least 2 or 3 inches above where the injury is. A rope is not going to work. It's too thin. You don't want to start cutting in. You want something a little wider, like a strap. Your belt is probably not going to work. It just isn't to get it tight enough. It may slow it down enough, but you're looking to try to tighten until the bleeding slows. Mark the patient somewhere visible with a tourniquet, with TK, Sharpie, on the forehead. Sometimes how you do it. And with a TK and the time. So for a tourniquet, but I will tell you most of the time with bleeding, you're not going to need a tourniquet. If you do well-aimed direct pressure, so you find the cut, you apply direct pressure with a gauze or a bandage, and you hold it there for at least 5 to 10, 15 minutes. You're not wanting to, and you don't take off a gauze and put another one on. You just put it on, unless you're just, there are times where people have got so much gauze, they're not pushing on the injury anymore, and that's ends up being the problem. Quick clot works for like big cuts or something, but it's not necessarily going to help with like an amputation or something like that. But quick clot is helpful, and if you get like a nice big flap on your skull, quick clot will help with that. And then CPR. Unless you've been trained and you have a mask or a shield, if you watch someone collapse, we are at the place where for the standard bystander, you're just going to do compressions only CPR. You have oxygen in your bloodstream already. The goal is to circulate it. So you're going to do compressions at a rate of about 100 beats per minute, which is right about like that. And you're going to do compressions at a rate of about 100 beats per minute, and for adults, which is typically where you're going to be at, about 2 to 3 inches of compression. And it will make noise. I've done it. I've done CPR multiple times. It sounds weird, gets kind of crunchy, but it's necessary. And just things to think about. Now, as far as placement goes, and so this is one of those things. When it comes to a medical emergency, think about dealing with spiritual sin or spiritual things, right? Sometimes it requires getting messy and personal, and it's uncomfortable, and no one really enjoys it, but it's necessary. CPR is the same way. CPR, you bare the chest. You need to get whatever, so if I collapse, you're going to rip the buttons off my shirt or get my shirt open. You're going to cut my shirt open, my t-shirt underneath, and you're going to go nipple line right here, center of the chest, hands like this, arms locked over, and you're actually using primarily your weight. So you're not doing CPR like this. I'm one of the least favorite people to watch anything medical on TV with. I'm like, that's awful CPR. But you don't want to hurt the person who's underneath, so, okay. But anyway, so, but you're going to do good CPR, and so for me, I'd have like 4 or 5 people available to do CPR, because after about 2 minutes of CPR, you get tired. And so rotating out. And so you say, okay, you're going to do CPR first, you're next, you're after them, I will let you know, someone with a timer, keeping track, and someone writing down information, if you can. And for us, we're going to have probably a first responder here within 5-10 minutes at the latest. Not always, but things to keep in mind. So, questions. I think, wow, we got like over 10 minutes for questions. Yes, Gene.
You had said you could do CPR in like 15 seconds.
I could teach you CPR in 15 seconds.
How is that?
Well, for basic compressions. So, I just did it actually. Bare the chest, nipple line, center of the sternum, 2 to 3 inches, and hands like this, over. So I'll show you. How about that? Judson, you get to be my dummy. So you're gonna lay down. I'm gonna make sure that Judson is not unresponsive. Judson, can you hear me?
Yeah.
I will not bare his chest. We're not gonna do that to him, but I'm gonna find the center of the chest and take one palm like this, other palm like this, and I'm gonna get up and over him, and then I'm gonna go use my weight to do the compression. I'm not using my arms. I'm using my weight like this, and then what you're actually doing is you have someone else saying, hey, you need to go a little faster, or you're going too fast, you need to go a little deeper, and so I would actually probably be the one starting, but prepping the next person to come to do it. But that's for my case. Yes,
So
Chief.
you don't do any blowing?
So if you watch it happen, you have enough oxygen in your blood for at least the first 8 minutes. The primary thing is to be circulating the oxygen in the blood that's already there. Because what actually is happening is it takes about 8 to 10 compressions for what's called the intrathoracic pressure to build up to start pumping, because you're mechanically pumping the heart, and the pressure within the chest is actually doing the pumping of the blood. So every time I stop to give respirations, that pressure is going to go down, and then I have to build it back up again. And if I'm not trained to do that, I might be causing more harm than good. Judson, you're all set. On top of that, if you aren't doing respirations correctly, you actually are going to be putting air in their stomach versus their lungs. And when you put air in the stomach, you're decreasing the ability of the intrathoracic pressure to be built up, because there's pressure in the stomach now. And then on another point, and this is just the way it is, if you don't know where they're from, where they've been, you don't know what they have. And then on another note, if you're getting air in the stomach, they will vomit. And what that means is you get vomit in your mouth. And if it doesn't mean you get vomit in your mouth, they aspirate, and now if they do make it, now they have to deal with the pneumonia and the lung infections afterwards. So unless you can really get a good head tilt, chin lift, good seal, then it's not recommended for a standard bystander to actually do respirations. Yeah.
A couple things. One is you showed it very good, but I want people to know that. Lock your elbows so that you don't bend your elbows doing it this way, but use your whole body up and down.
You're trying to lock your elbows right out.
You're only using the heel of your hand over the...
Yeah, you're not squishing with your hands like this. You're using the heel of your hand like this. And you're coming up right like that, and you're going center of the chest. And I'm actually locking my arms out to give the mechanical advantage, so I'm using my weight and my core as opposed to my biceps and triceps.
So the other thing is the shaking the person early is a very important thing today, because heart attacks can either be vascular or they can be electrical. And today you've heard people have pacemakers.
Yep.
You know, my dad was alive for many years because someone shook him in a library one day when he went unconscious, but he didn't need a pacemaker is what it was. I've had that many people that we've come across.
Yeah.
So that shake is violent enough. You just shake them different. You okay?
Yeah. And so
it may be just enough to stimulate their heart and get it going.
Yeah. So the time for niceties and politeness is gone. Mm-hmm. The time for action is here, and you and a nice sternal rub. Make sure they're awake.
What are the legal ramifications?
Legal ramifications, so check your state. In New Hampshire, I'm not quite as sure. In Maine, they have what are called Good Samaritan laws.
I think almost every state in the country.
Almost every state does. There are some differences from state to state. Basically, if you do the best you can to care for the patient, you're not going to get faulted. It's called a Good Samaritan law. And so, say you tried doing CPR and the person didn't make it, they can't, the patient's family cannot come after you for, well, you didn't do it quite right and that's why they died. No, you did the best that you could do with the resources that you had, with the time that you had, and that's really where that's as far as that goes. And the same thing is true for like first aid and CPR. So I actually have tangibles. So this is a Trauma Pack Quick Clot. It is actually a gauze pad that you can wrap, but it's impregnated with what's called Quick Clot, and it basically causes, I'm using big words, coagulation. It causes your blood to clot. So if you want to hand that around, you can. And then this is actually my conference bag. So in here I have gloves. Gloves are important, especially for bleeding. I have a face mask because I do know how to do this. So it's a nice little mask in here. You can inflate more air if I need to get a better seal. It has a one-way valve in case the patient does throw up, it doesn't go in my mouth. And then there is a set of gloves right here. So I'll hand that around as well. You can take a look at that. So, there's that. And then as well, I do have, this is not so much a boo-boo Band-Aid kit. This isn't, actually, I didn't even bring this up. If you go in our church and you start looking around, almost where every single fire extinguisher there's a first aid kit with Band-Aids and a few gauze pads and stuff like that. So there is that. So I've got my boo-boo kit. So I've got actually some bleed stop here. You can get this at Walmart. And the trauma pack I got at the REI. Bleed stop, there's instructions on it. It's just, it basically is a chemical reaction that causes the bleeding to stop. I remember my dad had one of those like little things when he gave himself razor cuts. Yeah, that's basically, and it stings as all get out. That's basically what this one is. The Quick Clot's a little different, but that's basically what that is. I got my scissors, and then in this one, there is a little CPR kit. So you can't really see what that is very well, but this is actually a one-way valve with a face shield. And I can unwrap that, and it goes over the patient's face, and then I can breathe through the one-way valve so I don't get vomit in my mouth. So there's that. Comes with a towelette for wiping down. It actually has check for dangers. So that's actually something that we didn't cover. So the thing that's drilled into you when you're taking first aid or different things like that is scene safety and BSI. So am I coming in and I walk in and I see someone on the ground, do I smell something funny? Because is there a gas or something leaking? Do I see anything that caused them harm that's going to cause me harm? Is there bare wires? Is there water with wires in the standing water? Those sort of things. So just as I'm walking up onto something, is the scene safe? Is there something that's going to cause me harm? And then BSI. So gloves, actually, back pocket. BSI, CPR mask. That's why you do compressions only. If you can't do anything else, compressions are better than nothing. So there's that. I have a few other things in here. So I got some medical tape. I have wipes. I have a pressure bandage and a few things of gauze and a cling wrap type thing. So you can actually have another Quick Clot on the outside, and then this is also for hiking, so you can keep your medications in it. But in that. So there's there's a few things as far as that goes, but just, yeah.
What if you're alone? Do you get on the phone first, or?
So that is one of those things, how alone are you? So if there's someone nearby, call for help. Like just shout for help. If you're in the basement, it's you and one other person, make as much racket as you can. It's just one of those things. We don't stand on principle. We don't stand on.
Middle of prayer meeting, it's okay to.
It is okay. There are more important things at this moment than not disturbing prayer meeting. If there's someone close by, they've gone back and forth. Sometimes what they'll say is do CPR for a couple minutes and then call. Other times it's call, then do CPR. Put your phone on speakerphone and do CPR while you call. That's probably where I'm at this point. If I was by myself and there was no one else who could call, put the phone on speakerphone, call 911, and do CPR while you're doing it. Just things to keep on. And the other thing is, like, if it's a bleeding thing, get them stabilized. And if you're by yourself, stabilize them, or somewhat stabilize them. In other words, get a gauze on, get a bandage on, then call. Like, you're trying. If they've got a hole, fill it. Kind of one of those things.
You didn't cover choking, but that's a big one too. Around churches with meals and so forth, when they're having church dinners, the choking goes on.
Yeah.
And how do you handle yourself if you're doing the choking and there's nobody else around you? It's an easy way to be done now.
So, choking, there's a few different things. There's the universal choking sign. Okay. The other thing is, if you're moving air, don't do anything but be ready to do something. Rossby, if someone's moving air, if they're able to gasp and wheeze some, then you're not going to do anything yet, but you're going to be ready to do something. So Rossby, give me the universal choking sign, okay? So I'm going to encourage him to keep coughing, and then at some point, if he stops moving air, he's bigger than me. I'm going to put my foot between his feet, so he's ready, so I'm ready. I got my other foot back. I'm going to find his belly button. I'm going to come around here, put my fist just above, so I find his belly button with these two fingers. Thank you for being a good sport. I'm going to feel his, again, you're just going to be personal. You're going to find his belly button with your two fingers. Take your fist just above it, above the two fingers. Here, let's face them and blind you at the same time. Yeah. All right, so 2 fingers on the belly button, fist just above, grab, and I'm going to go in and up with some force. And I'm going to do that a few times and see if I can get it lodged. Now Rossby, at this point, he's not had air for a couple minutes, and he's going to pass out. What do I do then? Well, I'm all ready. I have my foot behind him, and I can just lower him down. So I can just lower him down. And then you go straight into CPR at that point.
You can do it for yourself too.
And how you do it? How you do it for yourself? So you can use the back of a chair. Back of a chair, or you can try
it yourself. We tried it with the chair. It's very difficult on yourself to do it on the chair, but you can do yourself. What he just showed you, put your hand here. If you listen to me, keep your mouth open when you do it. Where's that air coming from? That's coming from my lungs. It's going to push out whatever's blocking up on top here.
Yeah, so basically you're trying to come up with self-rescue. Mm-hmm. You're trying to figure out a way to push the air out of your lungs and unlodge whatever is there.
Right.
So don't ever, if you look in their mouth, so say you do CPR, you look in their mouth and you don't see anything, don't go reaching in there unless you actually see